Hi, I'm Dr. Jack West, and I am an associate clinical professor in medical oncology at the City of Hope Comprehensive Cancer Center, where I also serve as the clinical executive director for Access Hope, offering remote consult services for patients with cancer. Coronavirus has led us to reevaluate what is most critical for our patients. And that means that if there are interventions that we are doing perhaps more as a ritual than because it's critical, we should reflect on whether we should reduce the frequency of that or even stop doing that ritual. So commonly, we are looking at our patients' scenarios and asking ourselves whether we should increase the frequency of visits, convert live clinic visits to telemedicine-based visits, if that's a possibility. But it really needs to vary depending on the situation a patient is in. If a patient has been screened for a presumed or even a known lung cancer, but it looks like it is very early and very small, we may be inclined to recommend delaying surgery for that to keep someone out of the hospital, keep them without requiring significant visits at this particular time, and hoping that several months from now things will be under better control. But importantly, if patients are being treated for more acute, life-threatening cancers, we need to respect and focus on that issue. So importantly, patients who need to get care for their cancer should not hesitate to do so. And that means that patients should get chemo and radiation. Patients who have higher risk cancer should undergo surgery. All of the standard treatments for lung cancer should really be applied just judiciously. If there are things that may be on the margins of whether they're clinically necessary or not, someone who is being considered for post-operative chemotherapy, but really doesn't have especially high risk, and maybe there was a good reason to debate whether they should do it at all. In the world of coronavirus, we would perhaps err on the side of withholding, not pursuing that, because the risk of developing coronavirus presents a new factor in the benefit versus risk equation. So it is a dynamic process. It depends on where you are in the world and how big a concern right where you are coronavirus is, what the resources are, but especially whether the patient's cancer requires treatment and continuation of the anticipated best care, or whether they are on surveillance and just getting intermittent visits, and perhaps those can be spaced out by an extra month and done by telemedicine to minimize the risk. Obviously, we want to minimize the chance of anybody with lung cancer becoming infected by coronavirus. The risks are higher of dying of coronavirus if someone has an active cancer, and lung cancer is among those. So we need to respect that, but we also need to prioritize the acute problem that someone has with their lung cancer and not minimize or shortchange that because of a concern for coronavirus that may not be nearly as acute an issue.